Hello, my name is Tika. Nice to meet you. I'm your psychologist today. So let me check your appointment first. So for today, you made an appointment to do 2 examinations, right? Okay. The first one is psychological examination or test with me to check your personality. Just a basic psychology test. And the second one is physical test, which is cranial nerve exam with Dr. Marie. Alright, so before we start our session, let me explain to you a little bit so you can be more comfortable and relaxed during our examination. Okay, perfect. So today's examination is just a basic test of psychology to get to know your general or basic personality. I will ask you 10 basic questions to get to know your basic personality and to identify is there any treatment that you need. So relax yourself. This is just a basic questions that I believe you can answer effortlessly because these all are just about yourself. The next step after I explain this, before we start, let's take a few deep breaths to make you more relaxed. Okay? Okay. Breathe in. Hold. Breathe out. 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 Okay. You feel better? Perfect. So let's get started. Your full name, please. Okay. Your phone number. Okay. Your email. Okay. Question number 1. How would you tell me about quality of your sleep? Is there any sleeping habits that make you having difficulty or disturb your sleep? Okay. Question number 2. How would you describe your eating habits? Would you describe your appetite or if you do any kind of diet? Okay. Alright. Okay. Oh, I see. Okay. Number 3. How often you feel you can control your moods or stress? And would you tell me how you handle it? Okay. Mm-hmm. Okay. Good. Number 4. How frequently have you had less interest in the activities you usually enjoy? How long that feeling usually stay? Okay. Mm-hmm. Mm-hmm. Alright. How long it will be? Okay. Mm-hmm. Okay. Alright. Question number 5. Have you ever experienced an attack of fear, anxiety, or panic? Mm-hmm. Alright, that's okay. Mm-hmm. Mm-hmm. Okay. In a scale 1 to 10, how many? Okay. Mm-hmm. Okay. Okay. Okay, I understand. Now we move to the next question. How frequently have you been bothered by anxiety or not being able to stop worrying? Mm-hmm. Okay. Oh, okay. Anything else? Okay, I see. The next question. How confident you have been feeling with yourself and your capabilities? Any kind of capabilities that you have. Okay. Mm-hmm. All right. Okay. Number 8. Can you tell me about your hopes and dreams for the future and how you're working toward those goals? Nice. Okay. Mm-hmm. Seems that is your passion. All right. Nice. Mm-hmm. Okay. Next question. Please describe how supported you feel by others around you, your friends, family, or otherwise. If you have in a relationship now, how you have been feeling about it recently? Mm-hmm. Mm-hmm. Okay. Yeah, I understand. Okay. The last question. Would you tell me about your daily activity and how much enjoyment do you get from there? Is there any important activity or things that mean something to you? Mm-hmm. Okay. Yeah, it's normal. Mm-hmm. Okay. Alright. Is there anything else? Okay, I see. Perfect. So this is end of our examination today. Is there anything you want to ask him? Alright. If you have any question, you can call me or email me later. And the result of your examination today will be sending to your email. But if I see generally, I think there's nothing to worry about. But to get the detail of your result, we will be sending to your email later. Okay? Okay. So after this, I will sending you to Dr. Marie for your cranial nerve exam. Thank you for attending your test today. Okay. See you later.
Hello and welcome. I am Dr. Marie. How are you? So you've just got the psychological test with Dr. Tika, is that correct? How was it? That's good. Perfect. Okay. So you are here with me for a cranial nerve exam. Okay. Did you have a cranial nerve exam before? It's the first time. Okay. There is nothing to worry about. Okay. It's not gonna be a long exam, but I'm going to test a few things with you. Okay, so there's nothing to worry about. Please take a seat. Thank you. And I'm going to put on my gloves. Okay. So those are my latex gloves that I need for the cranial exam. So I'm going to ask you a few questions prior to the exam, all right? So, yes, I'm just going to inspect you, okay, with my magnifying glass. All right. Just a general inspection. Perfect. All right. So, do you have walking aids? Do you have hearing aids? Do you have visual aids or prescriptions? Okay. So now regarding the olfactory nerve, all right, did you notice any recent changes to your sense of smell? All right. Okay, so I'm gonna give you a few items. You're gonna need to close your eyes for me, okay? And you're gonna have to guess what it is, alright? There is no tricky things, okay? So it's just the formal procedure, alright? So please close your eyes, thank you. Okay. Perfect. The other one. That's very good. This one. Perfect. And we have the last item. Perfect. That's a good job. Now, the optic nerve. I'm just gonna inspect your pupils, the size, the shape, and the symmetry of them, alright? So just stay still for me, thank you. Okay. Alright, thank you. So, the visual acuity, I'm going to show you the chart and you're gonna tell me which letter I'm showing you, alright? Perfect. Are you still feeling comfortable? That's good. Perfect. Perfect. Very good. Yes, good job. Very good. Very good. This one. Very good. You did an amazing job. Now the pen light, so I'm gonna shine a torch into your eye. Just focus on the light. Thank you. Just follow the light for me. Very good. Now I'm gonna, like I said, shine the light in your eye. Alright. Very good. You're doing amazing. Perfect. Now I'm gonna need you to focus on the white wall behind me. Alright. And then to switch straight away to my finger. I'm gonna move my finger just like that. focus on the wall, and then please focus on my finger. Switch to the wall and switch to my finger. Very good. You're doing amazing. Now the colors. I have a bunch of colors with me and you're gonna tell me which color I'm showing you, okay? Perfect. 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 You're doing great. You're doing great. And the last color. Amazing job. Now focus on my nose, okay? And I'm gonna be moving the right or the left or both hands, and you're gonna tell me which hand it is, if it's the right, the left, or both. Focus on my nose. Very good. You're doing amazing. Yes. Perfect. All right. Very good. Okay, now the visual field assessment. I'm gonna need you to move your eyes, but first, do you have any pains with your eyes when you're moving them? Okay. Now, could you please target the wall, the white wall behind me, and I'm gonna be moving the pen light just like that. Perfect. Now, the cover test, I'm gonna need you to cover the right eye and then the left eye, and you're gonna tell me when you see the finger. Very good. Very good. You're doing amazing. Very good. Yes. That's perfect. Alright. So that is now the trigeminal nerve, minor nerve. So it's the sensory assessment. Close your eyes. Do you feel my touch? Yeah, the forehead, yeah. The cheeks, the chin, the nose, yeah. Very good. The motor assessment now. So I'm gonna clench the teeth, okay? Clench the teeth for me, and I'm gonna palpate the jaw. All right. Perfect. Okay, open the mouth, please, and I'm gonna apply resistance underneath the jaw, okay? open the mouth and I'm gonna apply resistance. Alright, perfect. Now, the facial nerve. So, did you notice any recent changes in taste or in hearing? Okay. That's all good. Yeah. Okay. Now, the facial movement. So, could you please do a few things for me? Alright. So, I'm gonna need you to raise the eyebrows like you, as if you are surprised. Perfect. I'm gonna need you to close the eyes and don't let me open them. Perfect. Now, blow out your cheeks and don't let me deflate them. That's great. Perfect. And now, could you please whistle for me? That's great. And do a big smile for me. Alright, that's great. Thank you. So, now, to finish the gross hearing assessment, I'm gonna say 3 words and 3 numbers. And you're gonna have to tell me which ones I chose. Okay? Which one I am whispering to your ears. Alright? Okay. Robot, robot. Tiger, tiger. Water, water. Very good. And now the numbers. 22, 22, 13, 13, 40, 40, 40. That's perfect. Thank you. So now the accessory nerve N is one of the last parts of the cranial nerve exam. Alright, so I'm gonna need you raise your shoulders and I'm gonna be pushing them downwards. Alright, perfect. Raise your shoulders for me. Thank you. That's great, thank you. Now, turn your head on the right and okay. I need to resist the movement. Alright. Turn your head on the left. Okay. That's great, thank you. Another questions before the exam is finished. Do you have any problems, then any pain when you coughing on your talk, or your swallowing? Okay, nothing at all. That's perfect. I'm just gonna need you to tell me a big for me. Thank you. Okay, I'm just gonna take my pen light, alright? That's perfect. And you will need to cough as well. A big cough. Thank you. That's perfect. Thank you very much. So this is the end of the cranial nerve examination. I hope that you enjoy the little exam. It's not meant to be enjoyable, but in our clinic everybody finds it very relaxing. Okay, so I hope that you have anyways good moment with me, with Dr. Tika and Dr. Marie, myself. Alright, everything turned perfectly. Okay, and I'm very happy with the results. Alright, so take care and see you soon. Alright.